Bromac.
Bromac, okay.
So Bromac is a combination of bromelain, which is an enzyme or a series of enzymes from the stem of the pineapple plant, together with N-acetylcysteine. And we were screening for a drug to dissolve a highly mucinous tumor called pseudomyxoma. And we went through heaps of drugs and nothing worked. And then I said, well, okay, just start combining things and see what works. And one day, a combination worked very well. And we then worked out the science of why that was.
Wow, so you actually, you made the observation and then worked out the science rather than trying to predict it based off science.
It wasn't the other way around, that's right. It was just chance that we found something and then we worked out why. And then that has broader applications than just in mucinous tumors, yeah.
Well, it might cleave the spike proteins, or it does cleave the spike proteins on different coronavirus species. That's
I think that, yes, in COVID, we started off on the spike protein, but I think that there are other effects. We did some work in Brazil just recently where we, which has just been published, where we took sputum from intubated COVID patients and then we used our drug on that and showed that we could fluidize their really sticky sputum within about 10 minutes.
So maybe an aerosolized kind of treatment could be really effective for chest.
Right. We're doing that, yeah. And that is applicable to, I think, other causes of ARDS apart from COVID. And the other interesting things in COVID is that the cytokines and chemokines that are in their airway, which drive the inflammatory problems, our drug cleaves those. And so I think it will have quite good anti-inflammatory action in the respiratory tree as well.
I mean, N-acetylcysteine is something we learn about to give for an overdose of Panadol.
Yes.
And then to hear that you found a use for it that is so different to a hepatic metabolism of that innovations. Did you always have this innovative kind of mind while you were going through your training? Were you seeing procedures and thinking there was opportunities to improve the whole way along? Or was it something more, once you were established, you started looking for problems to solve?
I've done a number of pretty strange things along the way, you know.
What was one of the first early ones? What's one of the first things that you changed?
One of my favorite ones was cryo, which is freezing tumors. And again, when I was in the States in mid-80s, I met up with a guy there who was interested in cryo as well. And we then both developed cryo for treating cancer, but I basically made a machine in the garage, and we treated people with that, and then it got better, and we got an engineer, and the engineer made a lot of improvements, and so on and so on. But developing things is good fun, and the kind of safety side of it is clearly something that we're, as doctors, we're used to, and we're used to also working out whether something is really ethical or not. And if you've got, and fortunately, most of the patients that I have worked on developing treatments for do not have other good options. And even now with the COVID stuff and the respiratory stuff, we're only treating people that don't have good options. If you've been on a ventilator for 24 hours and you're not improving, we don't have an awful lot left for you. So, you know, and that makes innovation and the ethics of innovation a lot easier.
Makes it a bit more simple, yeah. One of the questions from one of the subscribers, by the way, massive thanks to your administrative staff who set this up in such a quick time, but I just sent out a message to some of the subscribers to see if they had any questions to ask. But one of them was, how can you get involved in drug development as a doctor but not let it bias you in your therapies?
That's a constant concern, but on the other hand, you have to move beyond what you do yourself in that, for example, in the first work we did with Bromac, we did that here. It's now in phase 2 studies in Europe.
It's phase 2?
Yeah.
I didn't know that.
The US.
That's very exciting.
And so, and that's something that I kind of, I'm not involved in. And so, and when you write your results of stuff that you've done yourself, you declare what your involvement is. So, yeah, I get it. But kidding yourself is not a very smart thing because, it's going to get repeated. One of the happiest days I had about 2 years ago was when an American scientist actually repeated our work and extended it.
An independent body.
Independent. Hadn't even talked to us,
wow.
just did it. And that was really good because I always tell the guys in the lab, it's really good when you give me crap results because it means at least I know you're being honest. You know what I mean? And you have to be honest with yourself about stuff.
I mean, that's one of the core beautiful things about research is that it's an approximation of reality.
Yeah.
This complex thing. And so if you just, as you say, you can't lie to yourself because you're trying to approximate reality and other people will use your tools to do that in their labs. And if it's different, then you've got a big problem on your hands.
Yeah.
And that's how I feel as well. If you're getting involved in drug development, I mean, what's the alternative? You don't.
Yeah,
and then there's no doctors involved in drug development. That's a pretty bad recipe.
And we do need to be because you can be the smartest scientist in the world, but if you actually don't know what the problem is and what would be suitable for that and what would make it not a sort of a useful thing, then you're lost. And so you do need a bit of both.
That is iconic. And there's a quote from Elon Musk that kind of summarizes this in terms of engineering, but it's so true in medicine as well that the most common thing he sees is engineers optimizing things that shouldn't exist.
Yeah, that's right.
It's you've got to know why are we making this medicine? Why are we developing this tool? Do you need this tool?
Yeah.